So Erbs palsy. So for 3 marks, you'll have to write about 6 points. Erbs palsy, so which is an Erbs palsy seen in newborn infants. So C5, C6 are the roots, and here you have what is the Erbs point, right, of the brachial plexus. The region is called as the Erbs point, which they have shown here. This point here, okay, this one. So which they have marked here, right? Isn't this the one? Erbs point, this is. So the region of the upper trunk of the brachial plexus is called Erbs point. That's all they have mentioned here. Now let us look at the Erbs palsy. So you have here what they have mentioned, Erbs paralysis they have called as. So you can see how the child, the newborn child, the hand is in backward turned, you can say. So this is because of what? C5 and C6. See, people say it C5, C6. These are the spinal nerves, right? Spinal nerves. C5, C6, not the cranial nerves. These are the spinal nerves, remember. C5, C6. That is the cervical, right? And this is what happens here. The nerves roots which are involved are C5, C6. So which are the muscles that are affected if they ask? That is the deltoid. So where is the deltoid? Let me just draw here so that you will not forget. Deltoid is affected. The supraspinatus, so that is behind on your scapula, supraspinatus, infraspinatus, biceps brachii. Okay, then yeah, okay, so where were we? So here we are brachialis, brachioradialis. Radius is where? Brachioradialis. Then supinator, extensor carpi radialis longus. So extensor carpi radialis longus. So these are the muscles which are affected. So what is the position of the hand? It is a policeman tip. You know, the policeman puts his hand back and trying to ask you for money. So that is it. Or a porter's tip or a waiter's tip position. So where they're taking it from the back, the money, they're asking you the money that way. So that is what they are calling it. It could be a little derogatory to say that it is used by a porter or a waiter. Sensory loss also can be there. So it's not just a motor. They're saying sensory loss can be there sometimes. Outer aspect of the arm. Outer aspect of the arm. Arm means what? Arm is this one, right? This is arm. So this is arm, and this part of it is forearm. So this is arm, and this part of it is the forearm, and then you have the hand. So they are saying the outer aspect of the arm can have sensory loss. So let me mark that as yellow here. So here there could be a sensory loss. Okay, sometimes it can happen. Now why does this happen? That they didn't explain in this particular thing, but it is because of a pull during the delivery of the baby. So Erbs point, where can you see? It is C5, C6, right? So if you see the brachial plexus, you would have drawn this umpteen number of times. If you draw this, you will get very good marks very quickly if you draw this. Just say brachial plexus C5, C6, C7, C8, T11, but you are concerned more about what? C5, C6. Where is the Erbs point here? Somewhere here it should be, right? Upper trunk Erbs. This is the upper trunk. This entire thing is upper trunk, right? So here, upper trunk Erbs. This is the Erbs point. Okay. So basically, if it's a breech presentation or there is some risk where the baby can suffer injuries to the neck, so you should be very careful not to pull the baby. Okay. So that's it about Erbs palsy for the first question. So 3 marks guaranteed if you draw the diagram. Okay.